Have you ever wondered what would happen if the brain areas responsible for language are damaged? Will a person understand the language? And will they be able to produce a speech and communicate? Well, the answer is no. This person will have a disorder called aphasia, which may result in speaking, writing, and communication difficulties for him. Hello, I'm Basmala Saberi, and I will explain aphasia, its causes, types, and treatment mechanisms to you. Aphasia is a communication disorder caused by a brain injury like stroke or any neurological disease in the frontal and temporal lobes of the brain. Those areas can produce and understand language, so any damage in them results in aphasia. Aphasia is an inability to comprehend or formulate language. Therefore, aphasia results when an injury happens to certain areas like Broca's and Wernicke's areas. Now, let's dive into these two types of aphasia. The first type is Broca's aphasia, or non-fluent aphasia, which is caused by damage in Broca's area, the area responsible for speech production. Let's see a video of Broca's aphasia patient talking about his job published by Tactus Therapy.
Worked Autodesk 7 sales.
As you noticed, people with Broca's aphasia have difficulty speaking. They struggle to think of words. Their understanding, comprehension of a language is reasonable. They just use wrong words, made up words, make short sentences, or use only single words. But their comprehension or understanding of a sentence is good. On the contrary, the second type, which is Wernicke's aphasia. In other words, fluent aphasia. It's caused by damage in Wernicke's area. This area is responsible for language comprehension because it receives and connects the visual and auditory information in the brain. Let us see an example of Wernicke's aphasia patient talking about a cruise.
They're diving for them at the moment. They'll save in the moment. He'll have water for.
As we saw in the video, people with Wernicke's aphasia babble. They use incorrect words. They create long, complex sentences that don't make sense. They usually are not aware of the wrong words they use. Finally, the treatment. There are different ways to rehabilitate aphasia, as some doctors give medications to heal the physical symptoms of a stroke. Besides that, aphasic people go to a speech therapist or a pathologist to determine the communication issues and work on them. They work on them by creating and following a personal treatment plan. The treatment plan can include personalized techniques for individuals or group therapy. Finally, the aphasia treatment is a long-term journey, starting from 6 months to 2 years. This journey requires consistency and expensive. The good news is that researchers are working on efficient methods to treat aphasia over a short time period, which are electrical current and magnetic stimulations on the brain. These techniques were experimented with patients and had incredible results. They enhanced the efficiency of the healing aphasic people. Don't forget to like this video, share it, and subscribe, and thank you so much for watching.